First of all, thank you so much, Dr. Burgos, for joining me today and for helping myself and other UAG students with your valuable information. Welcome.
Thank you. Happy to be here.
So I was wondering if you could please tell us your journey in medicine.
So I'm from Puerto Rico, and I did my bachelor's in microbiology. And how I ended up in UAG is UAG. I don't know if you guys have noticed, there's a lot of Puerto Ricans there. So they have an office in Puerto Rico, and a lot of the reps will go to the school always. And in undergrad, I will always say, you know what, I want to study abroad. I don't want to study here in Puerto Rico. And unfortunately, when I started medical school, I didn't go to UAG. I started in Antigua, in UHSA. And after the first hurricane hit Ilma, we were trying to leave the island, and it was like $400 to just get out of the island to back to Puerto Rico. And I was like, you know what? I cannot be doing this for 2 years. I'm a student. I'm on loans. I'm gonna transfer. And I transferred to Guadalajara, where originally I wanted to be at, and the best decision I've ever made.
Aw, yay. That's yeah. It's funny that you mention it. Yes, I didn't know because I'm in California, so seeing a lot of Puerto Rican students, I was surprised. I was like, "How did y'all know?" Because I found out in a very like last minute way, you know. So it's cool that y'all were like knowing about this school from the get go.
Yeah, because in Puerto Rico we have 4 medical schools, but I mean we're a lot, and just 4 medical school is not enough for us. And usually, like, you will get out of class and there was a UAG rep there, and then you will get to from the other class and there was another one there. So you're like, okay, I'll go.
Okay, that's cool. um, so since when did you begin UAG?
I started at UAG January 2018. Yes, that was my second year of medical school.
Oh, okay. So then, how was it from then on, like in terms of your steps and rotations?
So I don't know if you guys know. Well, UAG doesn't require you to take your steps for graduation like other Caribbean schools do, and I think that's like I think not so good. But since going into UAG, I never followed their curriculum per se. I always used to follow United States medical students' curriculum. So like I saw everybody was studying for step 1 before rotations, I did that. And for step 2 as well. But I did start my clinical rotations before taking step 1. I wish I would have done it before starting rotations. That is something I highly suggest doing. So I took my step 1 in my second semester of third year, almost going into fourth year.
Okay.
And then I took my step 2 in October of last year, almost just right before starting the applications for ERS.
Oh, okay, okay. Yeah, I've heard that too recently that you don't have to take the step 1 to do the rotations, but it is advised, I guess, because it's going to help you during rotations, the information that you gain as you study.
Well, not necessarily, because step 1 is a lot of, molecular stuff and things that you're not gonna see clinically.
Mm.
But it helps you because you don't have to like, oh, I gotta go to rotation, then I gotta get home to study for step 1. Because step 1 really consumes a lot of time, and it really needs your attention to be able to, get a good step score. And when you go to rotations, you want to get home and study for your step 2 and your rotations, because that's going to help you when you go into transition to residency as well.
Oh, okay. Okay. Noted. Yeah. So in terms of studying for step 1, what resources did you take?
So at first I was really overwhelmed with all the resources that were out there. Somebody's gonna tell you do this, do that. You gotta be honest with yourself and realize, okay, I study better by videos where I study better reading, or do I need a foundation, or you are an active learner, Anki. So I was struggling a lot at first. I did Boards and Beyond, I did Sketchy, I did UWorld, I started RX. It was too much. So at the end I switched and just stayed with First Aid, UWorld, Sketchy, and Patoma.
Oh, okay.
Yes.
So for the UWorld, it's only a question bank, correct?
Yes.
Okay. So did you use that from the beginning?
So I didn't start UWorld until I started what's called dedicated time for step 1. I wish I would have started it earlier. And I did 2 rounds of UWorld. That's a lot of questions. It's like 3,000. I don't know how many more because they keep adding every day from what I'm seeing.
Wow, you did two rounds with dedicated time. Your dedicated time, was that a time that UAG gave you off?
So UAG does not give you time off. You can plan it out. Like for me, my biggest consejo I could tell everybody is, since day one, take your courses seriously. Like I know UAG provides like the PowerPoints. That's all you need to pass their exams. I don't know if they have changed, but integrate questions. Do RX. Like if you're studying for cardio, buy the question bag for USMLE RX and just do the cardio questions. So when you get to your second year and you start studying for step 1, you're not starting from scratch, and you already are exposed to the type of questions they're asking you and how are they asking
it. Okay. That's good to know. It's a lot.
It is.
But okay. Did you also use those same resources for step 2 CK?
So for step 2, I only use Online Method. I don't know if you guys heard it. It's like this little book. And their videos are free. Actually, I think they also have for step 1 now. Their videos are completely free and they're like straight to the point. He doesn't make you memorize anything that you don't need to know for your boards. It's really good. And the videos are short, so they're like 15 to 20 minutes. So you don't lose concentration for a 1-hour video. And UWorld.
Okay. Oh, and UWorld. So you recommend Online Method and UWorld?
Yes.
And then, okay, I have another question, and it's regarding the ECFMG. Yes. Are you certified?
I am currently waiting for the documents to come in, but I did start the process already. And that is something you need to be on top of, because the ECFMG takes a while, UAG takes a while as well to process your documents. And they don't guide you as well, and that is something I think they should, explain a little bit more. And it costs money because you gotta pay for your translation, you gotta pay for your credentials, and there's something else that they ask you to pay for, and you gotta pay a form as well for the ECFMG.
Wait, the previous amounts that you were saying, was that from UAG that you have to pay, or?
Yes, you gotta pay UAG for the translation of your degree and the credentials.
Oh, okay.
So even for applying to step 1, you need to start something that's called the Form 186, and that's through the school and the ECFMG. And I think you have to pay like, I don't know if it was 100 or 145. And that's basically so they can give you your USMLE number. And for that number, you're going to use it for everything related to the ECFMG. With that, all the communications, and that's how you apply for your steps, and as well for the ECFMG certification. And the role is, like, for the ECFMG certification, you need to have graduated because they need your title from the school. So for residency, you can apply while still being a student, but always try to have your ECFMG certification before the deadline for the rank list. Because before the cancellation of Step 2 CS, I think it wasn't like necessary until like the start of July 1st. But with all this going on, I think that's gonna change, and it's gonna be required before the deadline of the rank list that usually is in March 3. around there.
Even though it's not required, would you recommend us to wait to be certified and then apply, or do you think it really doesn't matter like they say? Because I know that you see US-IMGs are, like they have a disadvantage within residency. So I was just wondering if that would help, maybe, in your opinion.
So if you graduate in May and you're applying to residency in September, I think you can go ahead and still apply. But if you already graduated, 100% you need your ECFMG certifications. Yes, it helps because some programs don't require it before interviewing you, but some do.
Okay, thank you for that. Okay, I have another question, and it's about your rotations, actually. So I wanted to know a little bit more about your experience. If you remember where you went, that would be nice as well.
So for my third and fourth year rotations, I picked San Antonio, Texas, because this is where I live. This is my home. I'm not in Puerto Rico anymore. And my experiences were good. Not all of my colleagues can agree to that, because it really is gonna depend on the student's attitude and the preceptor they get. Because unfortunately, sometimes we get the good ones, sometimes the not so good ones. But for me, it was really good. I learned a lot. There were really pro students. The only bad thing about doing rotations here in San Antonio, that they were not like teaching institutes. There were private doctors, and networking then is gonna be a little bit harder when they're just like already in private practice or something like that.
Oh, why do you say that?
Because usually, I don't know if you know what's the away rotations.
Yeah.
So US medical students do what's called away rotations. So when they start their fourth year, every month they go to like a teaching institute. They apply through VSLA. I can send you the link later so you can go ahead and look more information about that. But you have to apply, and you have to have your steps, and it costs quite a few bucks. So that's when you go through that portal, you apply to these away rotations. Let's say UT Health San Antonio, they're offering a lot of electives. And let's say you want to go for an elective in nephrology, you apply through that portal, and then you come for that month, you come to that teaching institute and you do your rotations. And some of them, they even offer you an interview after you're done with your away rotations. So that is something very vital that US medical students depend on to make connections and show to the program, hey, this is what I have to offer. Please consider me for a future position as a resident. And I don't think a lot of UAG students know about this. And it's so important, especially for us, that we depend so much on connections and letting everybody know what we have to offer.
What you're saying is that this is what US students use, but can UAG students apply to that as well?
Yes, I think you have to contact Arturo, if I'm not mistaken, so he can give you access to the portal, and then you can see the list of away rotations. And if the institute, let's say UTESCA, you don't see it there, you can go to their website and just call and say, hey, I'm interested in doing a rotation there. What are the steps to follow? Like, you can also apply off the VSLA, I think it's called.
And that program is like an institution, you say, like it's more of a teaching program?
Yes. All of the rotations offered through that portal are hospitals that can offer you a residency position.
Oh, okay. So that's why it matters, because even though you're going to a rotation that's private, and yes, you're gaining valuable information, and yeah, you can get a letter of rec, but at the end of the day, it wouldn't help you in terms of getting a residency spot.
Correct.
Because they can kind of offer you, like, even before you apply? How does that work?
Yes, because usually the intentions of the away rotations is for that. So it's like an audition rotation. So if you do excellent those 4 weeks, they, instead of you having to come back to them for an interview, they just interview at the end of your rotation. And this is usually, they do it on their 4th year before applying to ERAS.
Oh, okay. And to apply to this, you need to have both steps.
Yeah. That's something I wish I knew beforehand. I didn't do it. And I think Guadalajara, I think Arizona, the hospital that's affiliated with Arizona offers residency positions. And I think the Chicago one, I'm not sure because they constantly update their hospitals. So that is something to look into when applying to your rotations. Like, let's say you can do third year in let's say here in San Antonio that didn't, all of the doctors were not from UTESCA or let's see UT Houston or for something like that. But for fourth year, that is something you really want to consider.
So we should, just to make sure that I understood, we should make sure that we go to a rotation that is teaching based. So when we look into all of the list that UAG provides of their connections, make sure, go to their website and see if they're like a teaching hospital.
Yes, correct. Like they offer residency positions there.
Okay.
Because you can also do rotations in Puerto Rico. And from the ones listed from Puerto Rico, if I'm not mistaken, Mayagüez is the only one that offers residency position. They have internal medicine and family medicine. And that's why everybody wants to apply to Puerto Rico to do rotations there. And it's a limited amount that they accept. And I think Manatee is also on the list, but Manatee offers the internship, not the residency. But it's still a good something after you finish if you have to take 1 year off.
Oh, okay. That's good to know. I'm sure a lot of people who are wanting to go back to work in Puerto Rico would like really appreciate that as well.
Yeah.
There's some students who consider doing rotations in Mexico. What would you say to those students?
Honestly, if they're considering doing that, I will do it for third year. And at least for 1 semester, not the whole 2 semester, because even though you learn a lot, I mean, in Mexico, in the hospitals there, you learn so much compared to the US systems hospitals. Like it's an experience you're not gonna get here in the United States or in Puerto Rico or anywhere else, and it's something really unique to you, and that's something you can contribute to your residency. But unfortunately, when it comes to applying to residency, they want letters of recommendations from US doctors, like you had a UX experience, even though if you're in a US-IMG, because they want to know that you know how to work the United States healthcare system.
Oh, okay. Okay, yes. I've heard mixed like opinions, but I always thought about the letters of recommendation at the end. Ever since I heard about it maybe like 2 weeks ago, honestly. So thank you. And I have another question, which is, what were your extracurriculars during medical school?
That is something that I wish I knew I had to do as well since the start. So for first year, I didn't actually do anything. Second year, I didn't do anything for second year as well because I was studying for step 1. So I started like around third year. I started volunteering here in San Antonio for the Texas Kidney Foundation, and I really loved it. So I will usually go a lot. I volunteer also for the Methodist Hospital. I signed up for mentorship for pre-meds as well. And I don't know, like everything, we need a volunteer for here. I'm like, okay, I can go and help. And for my fourth year, when the pandemic hit, my last semester, I had to go to Puerto Rico because Texas said, no, I'm sorry, we cannot accept any students from international schools because we got to give priority to our students. So I had to relocate to Puerto Rico for Guayama. So when that hit, a lot of rotations got canceled, away rotations got canceled, even though regular rotations got canceled. So I went to the internet and I'm like, you know what? I need to do something. I cannot stay with my hands crossed. And I got on Twitter, and Twitter became a thing. And I just started reaching out to people to see, I wanted to do research. How can I help? And eventually I met somebody, he's one of my greatest friends right now. His name is Oscar. And I'm like, hey, I see that you have papers. How can I get involved? I really don't know, like, how to, reach out to people to get involved in this. And he's like, oh no, you just gotta email somebody until somebody, answers you. And like 2 days after that, he called me saying that, oh, do you want to work on a paper? I'm like, sure. And I started working with him in the resident, and I got like 9 papers published with them.
What?
And it was all through the internet. So now like my biggest focus is trying to mentor and educate people how to avoid my mistakes and try to get them to get involved in research, because I think it's very important.
Yes, actually, that's something that I wanted to ask you about research. I didn't know you had research. I'm really glad you did, because I don't have any research experience personally. So, but I know that it's important or very looked at for residency. Um, like a lot of programs I think require a certain amount of research um, publications. I'm not sure, or experience. And so I don't know if you can let us know how to begin the process.
So that is something I wish I also had help with, because everybody's gonna say, yeah, sure, I can help you. And everybody likes to help, but they don't want to see you better than them. And it's sad. And honestly, UAG, at least for my group, didn't offer research opportunities. And what I thought research was for a student, it was like to get in a lab and work. But you can do case reports, and that's considered research, original articles, and that's considered research. You can also work in a lab, but honestly, that I don't know how you can get a position for that. And you can also try and volunteer, and sometimes they let students come and help, and that's something you can also put in your CV. So for the research, I got, like I mentioned, I messaged Oscar. He was so good to help me out and include me on his paper. He connected me to a resident, and that he's currently doing fellowship. And I didn't know anything regarding like how do you write a paper, how do you publish it. And so he taught me over the phone. He yelled at me a couple of times because I was doing it wrong. But he was so sweet to teach me. And honestly, like you can just, you can go to your local hospital or even contact residents. Hey, I want to work on research. Do you have any recent cases you've seen that is interesting, that is worth publishing? Can I help you? How can I help you? And sometimes a lot of residents have case that they want to publish, but they don't have the time. So that's where the medical students comes in and help them a lot and get them published. So like they can have you the case report, everything almost ready, and the student just has to dedicate to the discussion and get it published. And I think that's one of the ways to go about it. Just start emailing people, residents, or even in Mexico, because they have a lot of cases that you don't see here in the States that you can go to the resident. Hey, do you think we should work on a case report on this? I can get it published, and I'm pretty sure they're gonna say yes.
Oh, okay. So residents are usually the ones that do research, and also people in fellowships. And those are the people we should contact, probably through looking up like the hospital nearest me, like that, and then looking at do they have a list of residents there, probably within
They should. And even if the resident doesn't have a paper published, I mean, who knows if he has a couple of ones that he wants to publish, but he hasn't had the time to write it out. Like we say in Spanish, la peor gestión es la que no se hace. So you message everybody.
Yes, it's just a matter of like keep insisting. Okay, so now I have more questions about like ERAS, because you already applied, right?
Yes.
And so did you by any chance use like FREIDA, Match a Resident? And if so, like did you recommend it?
So I use FREIDA. I did get the membership for the Match a Resident. I don't know if I will recommend it, because it does give you a list based on your stats and like the probability, but not necessarily that's going to guarantee you an interview there. And things are constantly changing in medicine. So let's say this program doesn't have any IMGs, and just because it's not listed in FREIDA, that doesn't mean you don't need to apply, because you can be the first IMG going into that program. So it's like really, with all these tools, it's like really pick it up with a little grain of salt. I think you should just like follow your instinct. If you really want to apply to there, make sure you have good letters of recommendation and keep insisting. Because one of my interviews actually came from one of a program that I almost didn't apply because of the requirements they had, and I'm so glad I still apply. Like that was not on the list for master resident. So it's 50-50.
Okay. Thank you for that. Yeah, I'm recently like hearing a little bit about the stats and like the website, so it's good to hear it from someone who's actually gone through it. And so in terms of residency programs, I was wondering I don't know if you feel comfortable sharing with us, like how many places did you apply to, or like do you recommend that we apply to? Because I know that as US-IMGs, we need to, I guess, apply to more programs.
Yes, unfortunately, I always say like try to apply to the programs you really want to go into, because people are over applying. This is an issue that has been going on for years, but unfortunately for us US-IMGs, we need to apply as broad as we can, because we can get an interview from a place we didn't even know they could interview us. So I applied to more than 250 programs, because to the specialty I applied to is anesthesia. And it's a very competitive specialty right now in the United States, and for IMGs it's triple.
Yeah.
And unfortunately, I got a little affected with the cancellations of rotations, so I didn't have a letter of recommendation from an anesthesiologist. I didn't do a rotation in anesthesia, so that just made it 3-4 times harder for me in this cycle. So it's all gonna depend on the specialty you want, on how well constructed your application is. But I still think we should all apply to more than 100 programs. It is a very cost money process. So my recommendation is save from now. Don't spend money.
Okay. Thank you so much for that, because I didn't know how many numbers wise we should apply to, but it's good to know. So if you can tell us about your interview experience, did they ask you about UAG and I guess just like general like interview tips that you would give us?
So they didn't ask me particularly from UAG. They did ask me how did I get to Mexico from Puerto Rico. And my answer was honestly, like I've mentioned earlier, that because of the reps and there were promotional all the time, but also I wanted to see like the inside of the healthcare system, because it's different. I have 4 perspectives from the healthcare system: the one from Puerto Rico, the one from Antigua, Mexico, and the United States. And that's something that I think is very important when going into residency, because not everybody's gonna be from the same place. So you need to know how to work with different cultures as well, and see, like, it just gives you a different perspective going into residency, viewing all this. And that is one of the reasons why I decided to study abroad. And that's like the only thing they asked me of, why in Mexico.
Oh, okay. And then besides that, it was just like getting to know you questions?
Yes, they usually ask you like, tell me more about yourself. Like, I can't say exactly the questions they ask, but they ask the general things.
Oh, okay.
So why this specialty, and things about you when related to your CV.
Okay. That's good to know. And all of them for you were virtually, right?
Yes. That was something really interesting.
Yeah, that sounds interesting, but I'm glad. So you're done with this, right? Like, you're done interviewing and now you just have to wait? Is that how it is? Okay.
So when applying to competitive specialties, it's like, it's a 50-50. You gotta keep in mind that you can match or you cannot match. And I think that's in general for everybody. So right now I'm done with interviews. Tomorrow is actually when we find out if we matched or not. And after that, we will know if we have to go through the SOAP or.
Oh, wow. Okay. I didn't know that. Asking you very stressful questions. Sorry.
Oh, no, you're fine.
Okay. Well, you mentioned SOAP. I don't know if you can explain what that is to me, please.
So usually on Monday of match week, students find out if they matched or not. So I think the students who don't match get an email earlier saying, you don't match, so you qualify for the SOAP. So they can start getting ready, and they get, if they need to get letters of recommendations, if they need to do like a new personal statement, and they get like a list of all the programs that are available that didn't fill. That usually the spots that they offer is like internal medicine, I think prelims and surgery are the spots that usually are in the SOAP. And then you get everything ready, you submit before, I think it's 12 or 3 p.m., but you cannot contact the programs. Like you have it's like a scramble literally, because you have little time to get all your documents, get your application ready. Like you cannot research well enough these programs because the time is clicking. You gotta submit, and then the programs contact you, and like the first round of SOAP, they give you interviews and then give you offers, and it's up to you if you want to accept it or not. And then that goes for like, I think originally it's 2 rounds, but with this year they added an additional round, so I think there's like 3 or 4. And basically that's going on through all the week, and then on Friday they tell you if you match even with the SOAP or not, and on Friday everybody knows where they're going.
Oh, wow. So with how long is that process from the SOAP to?
It's literally just like 3 days.
Oh. Oh, okay.
Like you gotta prepare beforehand. Yeah, so
Oh, okay. That's good to know. Thank you for that. I've heard of SOAP before, but I don't know why, but I thought that it was just like a US thing. But it's a matching process, so it's like us were included
yes.
as well. Okay, that's good. I'm glad.
Yes, if you don't match, you're qualified. Yeah.
Okay. Okay, that's good. I was wondering if you could tell us about any mentors, if you have any, or if you have any advice on how to find mentors.
So right now I do have a mentor. His name is Dr. Diwali. I found him on Twitter. He's been such a great help. I mean, he helped me without even knowing me. I reached out, and he's been such an angel. And my recommendation is to use the internet. Like go on Twitter, create your account, reach out to people. Eventually somebody's gonna help you, wanna help you. Some are gonna say no, but that doesn't mean you gotta stop looking. Somebody's gonna help you and be like, you know what, I've been in your position, I'm gonna go ahead and help you guide there. And I found him, like I said, on Twitter when everything started of the pandemic. That's where like the networking is all going on right now.
Oh, okay. So through Twitter, you can just find like a physician and basically introduce yourself and say if they can help you. I guess what did you ask for in particular? Did you ask like mentor from the get-go, or did you kind of say like, this is kind of what I'm looking for, guidance? I don't know.
So I originally posted a tweet saying like, oh, I was confused because I've always wanted anesthesia, but going into medical school, everybody has an opinion. Everybody wants to say you can or can't do stuff. And while I was always saying that I wanted anesthesia, everybody like, oh, but you're an IMG, you can't do that, blah, 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 blah. And I let that get to my head. And so I was like, okay, let me, I guess, search for another specialty I like. And I liked internal medicine. And I posted a tweet like, oh, I'm caught between applying to internal medicine or to the specialty I really want, that it's anesthesia, but I'm scared that I won't get interviews. Everybody's saying it's so competitive. And that just blew off, and everybody was commenting, oh, if you need a guidance or help, I can help you out. And he offered, and so I messaged him, oh, like, thank you so much for offering me. What are your tips? What do you recommend? What books also you recommend? And he just helped me without even thinking about it, and he's been really sweet.
Aw, I'm really happy for you. I'm glad that you found someone that helps you out like that.
Thank you.
I personally I don't know how I don't have like a mentor like that. So I do want someone that could help me, but I guess my setback, I guess, is because I never know what to say. Because sometimes I feel like I don't want to bombard them with questions that are like basic, you know? So it's like how I don't know, like that's kind of what stops me, but at the same time I know that I should get one, but
No question is ever silly. That's the first thing. No question is ever silly. I mean, we're basically like swimming on our own, so it's good to seek help, especially when we need it. I mean, there's nothing wrong with it. Some are gonna say yes, some are gonna say no, some are gonna say information that you're like, no, I said no, thank you. So, like with everything, it's pick up the little good things, ignore the bad, because even some mentors are gonna be like, no, you can't do this, and to that type of mentor, don't listen to them. You always follow your dreams and what you want to do in life and never give up. So
oh, okay. Thank you for that. I have a question about any scholarships or programs, if you know of any, for US-IMGS. Because I have had trouble finding any, so I was wondering if you have encountered any.
honestly, that is something I really don't know.
Yeah, no, I feel like it's a hard question because before starting UAG, I really looked into scholarships for like full financial reasons, and a lot of them were just mainly for US students, and then I looked in Mexico, and they were like, but you have to be from Mexico, and I'm like, stuck. And so I think it's just something I'm gonna keep on asking until somebody helps me. Yeah, okay.
Yeah, I mean, I think there should be, but honestly, I don't know where you to even look for them.
Yeah, no, yes, I understand. It's difficult, so thank you for letting me know that you haven't, but it's okay. I'll keep on looking. I guess like my last question would be if you have any last remarks to current UAG students or students who are looking to apply to UAG.
So my biggest thing will be, work hard, study. Being in Mexico, I know some of you are online right now, but living in Mexico, it could be good or it could be bad. There's a lot of distractions, especially with the cost of living in Mexico is so cheap that you always want to go out, visit Mexico. It's pretty. But always remember why you went to Mexico. You went to study, work hard, and just don't always count on the school to keep you up to date with residency stuff. And I'm not saying it in a bad way, but you as a student also is your responsibility to know to look for this information, to keep up to date. What are the things I have to do? Don't always wait for the school to just come in. Okay, now you guys have to do this. You also have to be proactive and actively be seeking information, and don't ever let anybody tell you to where you can apply or not to apply or what specialty.
Yes, thank you so much. I really appreciate that because I feel like it's nice to hear from someone who's going into a very competitive specialty. Like props to you for doing that.
Thank you.
Because yeah, like I know you're gonna make it. I'm very like optimistic about you. I've seen like everything that you do through Twitter, and I feel like you're gonna be such a great anesthesiologist. So
thank you.
I'm rooting for you, and thank you so much for your time. I appreciate it.
Of course. And I mean, if you have any questions for any of your classmates, I mean, feel free to reach out. Maybe I can take a little bit time to reply, but I always reply. And I'm more than happy to help you guys because I really wish I had somebody to guide me through all of this in my process.
Yes, thank you so much. I'll put your Twitter handle in the description below.
Sure thing.